Good day, ma'am. I'm China. I'm your nurse in charge today. May I know your name?
Charmaine Tilos.
Okay. Ma'am Shamaine Tilos. So, when is your birthday?
September 12, 1968.
So, how old are you now?
52 years old.
Okay. So, ma'am, I'll be taking your vital signs for today. So, it includes your temperature, your respirations, your pulse rate, heart rate, and of course, your blood pressure. Is it okay with you?
Okay.
Are you in a comfortable position?
Yes, I am. Digital thermometer. Dry cotton balls. Alcohol swab or cotton balls with alcohol. Disposable tissue or towel. Stethoscope. BP apparatus. Plastic receptacle. Small notebook and ball pen. Gloves when necessary. Assess or palpate for adequate axillary pads. Dry the axilla with disposable tissue or towel in a patting motion.
Can you pat your axilla, ma'am? Thank you.
Take the thermometer from the case. Wipe the thermometer with alcohol swab from stem to bulb, following proper aseptic technique. Turn on the thermometer and place it into the center of the axilla. Ensure that the thermometer is in place. Leave the thermometer in place until the maximum temperature appears on digital display, beeps, and read the result. Wipe the thermometer with alcohol swab from bulb to stem. Note the date, time, method of temperature assessment, and reading on your small notebook. Locate and palpate the apical pulse. It is in the 5th intercostal space, mid-clavicular line. Warm the diaphragm and place it over the correct landmark. Take the apical pulse in 1 full minute. Note the pulse rate, rhythm, and strength, and record your findings in your small notebook. Locate the radial pulse using your index and middle finger. Radial pulse is the most common site on the thumb side of the wrist where the radial artery passes over the radius. Accurately take and count the radial pulse for 1 full minute. Note the pulse rate, rhythm, and strength on your small notebook. Consecutively, observe unobtrusively the respiratory rate. Observe the movement of the chest, the rise and fall for 1 full minute. Note for rate, depth, character, rhythm, and chest symmetry during respirations. And record this in your small notebook. Respirations are recorded as breaths per minute. Position the client. Uncross legs, feet flat on the floor, and with arm at heart level. Attain the client's normal blood pressure.
Ma'am Inos, what is your usual BP reading?
120/80. Using an appropriate size of cuff, wrap smoothly and firmly around the client's upper arm so that the lower border of the cuff is 1 to 2 inches above the antecubital space. The cuff or bladder should be snugly fit, not too tight and not too loose. Do not place the cuff over the client's clothing. Position the sphygmomanometer. Make sure that the regulator is closed. Locate the radial pulse using your non-dominant hand. Place the index finger and middle finger over the patient's radial pulse. Inflate the cuff until you can no longer feel the radial pulse. Then, add 30 millimeter mercury. Slowly deflate the cuff until you can again detect the radial pulse and note the reading on the manometer on your small notebook. Locate the brachial pulse correctly. Warm and put the stethoscope's diaphragm over the brachial pulse. Inflate the cuff until you can no longer hear the pulse. Then add 30 millimeter mercury. Note pressure at point where you first heard the regular sound. This sound is called the Korotkov sound. Note pressure at point where you heard a muffled sound and point at which the sound disappears. Remove the cuff from the patient's arm and do aftercare. Document the date, time, and blood pressure reading on your small notebook.
kilos. Your temperature is 36.5 degrees Celsius. Pulse rate of 67 beats per minute. Heart rate of 67 beats per minute as well. And our respiratory rate of 20 breaths per minute. And a BP reading of 120/80. All in normal range. Thank you for your cooperation.
Thank you also.